In the first year of MCAP, we researched establishing a 340B pharmacy program. We could have gone the usual route of setting up pharmacies within the community health center, but running pharmacies is not one of our core skills. Instead, we contracted with a local pharmacy. The arrangement has worked out well, with minimal startup and inventory costs.
The ability for patients to easily get to their drugs and to a pharmacist in their community, I think, outweighs all other factors. So, next steps for CHC. I'm very proud and happy to tell you that in New Britain, where you could literally throw a softball from our parking lot to the new Walgreens store, we have become the first community health center in the country to get Walgreens to sign with it for a FQHC 340B contract. They have 4,000 stores across the country. Having worked it out with us, I see absolutely no reason why they won't be open to doing this with anybody else.
We are located in a very large health department here in Asheville. What makes us unique is we have a primary care clinic. In the facility, we fill prescriptions for this clinic, an average of 550 a day. About 15 to 20% of that volume is free medication from pharmaceutical companies. Medication is very expensive, so it really doesn't take a huge amount of medication to reach a magnitude of a couple of $1 million, which is where we are right now. In the last 3 years, what we spend is going down and what we're getting free is going up.
That's good.
Yes, it's a good thing for county budgets.
My name's Late Night Dwight. I own a couple of restaurants in Muskegon, Michigan. Like most restaurateurs, we didn't believe that there was a program out there that we could afford to have all our employees be involved in it because insurance is just getting so high. This particular program makes it so that even our waitresses, dishwashers, and everybody can afford some health insurance. And in this day and age, to be without health insurance is like to be without a car. Everybody kicks in, everybody wins, and that's what we like to see in the good old USA.
When I opened the Glamazon, the premiums were just so outrageous that I knew it wouldn't be something that we could offer, and so I was kind of in a dilemma at that point as to, you know, what are we going to do? How am I going to draw employees? What's going to keep people from leaving?
People said, yeah, I could probably do something, but it has to be under $50 a month. So we knew we had a business willing to contribute $50 per employee or something under 50, and we had individuals willing to participate with something under 50 that could be used to help pay for benefit.
Oh, there's a big old sign, big old billboard, bottom line, $49, house coverage.
Our state was leaving money on the federal table, so to speak, and the state said, we'll let you pull it down. And that match money then becomes the community share of the 3 share. So $150, you know, we wrote our own contracts with our own providers. We set up a 501c3 to administer the program, and we created our own health program. No HMOs, no, you know, government-run thing, something with community oversight, and 97% of our doctors participate, and both of our hospitals participate, and hospice participates, and behavioral health providers participate, and people are mainstreamed, and they've got a pharmacy benefit, and our co-pays are low, $5 to see a primary care physician. We had over 400 businesses that participate. Just about 60% of them never offered a thing ever.
Just that easy, and then it was just up to the employees and myself to decide, do you want the coverage or not? And like I said, you'd have to be a fool not to, because it's so inexpensive. So it's a great program. You know, it's for a lot of different reasons, I think. For people that don't have insurance and for, you know, small business. Perfect. Perfecto.
I have to give your mom all your papers and things. Access to medical specialists has long been a great barrier for uninsured patients. Our solution in Middlesex County was to work with MPS, an association which includes 90% of the county's physicians. Together, we invited the private practices to adopt a sliding fee scale, similar to those used by our health center and the hospital.
We are a medical practice, and
we do not have the expertise nor the time to make these decisions, and that was always something that we found very difficult, because it's important that we're fair and the right determination is made.
In the past year, more than 50 physicians representing the major specialties have signed on. Other communities have gone a different route.
You do the best you can to fix them at the primary care level. If you can't, they end up in the emergency room as their only alternative. What do you do for that specialty care? So we solve the problem, and many of the specialists in the Hillsborough Healthcare Plan participated in this pro bono work because they felt it was their duty to the community. So when the plan came along, most of them said, heck, I'm going to get something where I was getting nothing.
And it's organized.
And what they did is they said, you know what? I am now, instead of able to see 5 patients of yours a year, I can now see 45 patients of yours a year. The plan really is a great model. And the other thing that I think benefits the plan is the recipients through sales tax are participating. Granted, maybe at a lower level, but everybody pays into the plan.
Yeah.
So even the users of the plan. Now, Florida's unique.
And anybody potentially could become a user of the plan.
Anyone potentially.
They're above for the grace of God. They're only one of us without
and that is very true.
Best known is the system of charitable care developed by the American Project Access Network.
What's happened here in Asheville in Buncombe County has been that we've taken the existing players in the safety net and we've strung them together and created a continuum of care system. We have gone from providing medical care homes to 50% of our uninsured to providing medical care homes and access to the full continuum of care for 97% of our uninsured.